Hi, I am Dr. Smita Pancholia, consultant HPB surgery and liver transplantation at Manipal Hospital, Bangalore. I will be talking about living donor liver transplant. What is a living donor liver transplant? It is the donation of by a living person of his or her liver to a deceased recipient. The first and the foremost thing is the criteria for donation is the person should be a family member. Second, the most important is the blood compatibility. Third, the person should be voluntarily involved in the donation. How do we work up for the patient? The first workup will be for the eligibility. After blood compatibility, the patient is eligible for a donation. We do a different set of simple basic blood workup along with the CT scan. In CT scan, we assess the volumetry, whether the remnant liver is sufficient for the living donor and the recipient liver which we take, whether the right lobe or the left lobe is sufficient for the recipient. After this basic workup, a person becomes eligible. Once the person is eligible, then whether the person is fit for the surgery. So where we do a cardiac assessment, where we do a pulmonology assessment, and thirdly the psychiatric assessment, where a person is doing things voluntarily. Once all this workup is done, at the day of surgery, the patient is admitted 1 day prior to the surgery. Followed by the surgery, patient is shifted to ICU for 1 or 2 days. Except for the pain, the patient is taken care of with the pain medications. After 2 to 3 days in ICU, the patient is shifted to ward. In the ward, the patient is given the normal diet along with the pain medications, and patient is properly taken care of for any of the side effects or any of the complications of the surgery, which in our team is none. And after 7 to 10 days, a patient is discharged. The only thing, the side effect or a complication or a side effect of the surgery is the patient is left with the scar. After the discharge, the patient is followed up in the outpatient department, and within 2 to 3 months the patient commences a normal life. The only few of the precautions which every patient after a surgery takes is not lifting the weight and not driving for some time. Then gradually the patient is brought back to the normal life. The liver, which is a beautiful capacity to regenerate, in 2 to 3 weeks, both the recipient and the donor have a normal liver. So the disadvantages of a donor surgery is a normal person being put under the knife. So patient will be left with a scar, some discomfort for few weeks to few months. Maybe in very few cases, patient may develop incisional hernia, or patient may develop during the immediate post-operative complications of a bile leak, which are very rare. In our scenario, in our team, the complications are